Warning. Listening to this show may result in increased levels of inspiration, motivation, and innovation. Side effects can include the immediate urge to take massive action to build a better business and life for yourself and others. You've been warned. Welcome to Influencers Radio with your host, Jack Mize.
Today, I can tell you that you're going to recognize some of the issues that we're talking about in either yourself, your family, friends, because this is something that a lot of people don't talk about, but it affects a lot of people. And you often don't think about it until you're faced with lack of options on what to do. When you have pain, and it could be pain that you never thought about before in your life. It could be pain that you've dealt with and think that that's the only solution is to deal with, and not realizing that there are options that may be hiding in plain sight. And that's what I want to talk to. We're going to talk about today with Dr. Robert Fennell, who is the founder and CEO of the Chiropractic Hand and Foot Clinics of America. And what I want you to think about that, you may have thought I just made that's a conflict. Wait a minute. Chiropractor, hand and foot. Chiropractic, hand and foot. Chiropractic is about cracking backs. It's what a lot of people think, but you're going to be really surprised and intrigued. And if you're suffering from some of these pains, hand pain, foot pain, you may just find something that you've been looking for a long time. Dr. Fennell is leading authority on chiropractic hand and foot care. Dr. Fennell, I want to thank you for being on Influencers Radio today.
Well, thank you, Jack, for having me on your program today, and I really enjoy the opportunity, and I'm just excited to be here and help your listening audience. Well,
you know what? I want to dive right into it. When I think of hand and foot care, I want to, let's figure out what that is. Usually when people think hand and foot care, especially if they even associate with a chiropractor, I'm thinking of things like reflexology. I'm thinking about things like massage and even,
acupuncture.
Acupuncture, right? So when we think of hand and foot care, let's go deeper into that, because those are things that can't fix problems that, when people are actually have deep pains and may go into things as extreme as surgery. So what is that hand and foot care is the way that you have come to develop it?
Yeah, I'm really glad you asked that question, because this can be a confusing point for consumers. I find this quite often. They'll say, in fact, patients will say, "Oh, hand and foot care. What do? Do you massage the muscles?" Actually, no. I focus on, and I do this both in my practice and I teach doctors do this, how to adjust the tiny bones and joints in the hands and in the feet. See, you've got 27 bones in your hands, 26 bones in your feet, and that's times two. So, 26 in each foot and 27 in each hand and wrist combined. And those bones can lose their healthy alignment, causing disabling hand and or foot problems. And chiropractors, as you're probably aware, focus primarily on adjusting the spinal vertebrae for things like neck pain and back pain and conditions such as that. So when people think of a chiropractor, you typically think a back doctor or somebody who focuses on the spine. You don't normally think of somebody who adjusts the hands or the feet. So it's really unique, and it brings a great value and service to patients in the community out there in different areas.
Well, so let's think about that. So when I visit a chiropractor, I go in there because I'm thinking back problems, right? I think of back pain, and I've gotten wonderful treatments and wonderful results. But I can tell you, my chiropractor has never done anything. He much more than shake my hand when I go to leave, or do much with my feet. Now, it's not saying that he's a bad chiropractor, because I get wonderful results, but I've never even thought to ask him about anything that with foot, especially foot pain. And when I think of adjustment and the way that you adjust my back and things, I'm thinking of how you do that with the foot. What is the process of that when someone is it the same way where you twist and you turn and you get the crack in there? Or is when you think of a foot adjustment, what exactly occurs there?
Yeah. And I don't want to scare your audience, your listeners, if they've never been to a chiropractor, but I just want to tell you everything that we do on our patients and everything I teach my doctors who I train, different parts of the world is all gentle. It's all meant to be a pleasant experience for the patient. So see, the patient may come in with a back problem to a chiropractor, and you're right. That most chiropractors aren't going to ask you about your feet and your hands. See, in chiropractic college, we're trained primarily on spinal care and spinal function and very little on hand and foot care. So as a result, you used to think of a chiropractor as a back doctor. So we focus on, we're changing the perception of the whole profession, if you will, of how chiropractic services patients, and so you'll come in for maybe a back problem. And during the interview process, if you're like in my practice, I would ask you about your feet. Do your feet bother you? Do you have any arch problems? Do you have high rigid arches or flat feet? And many patients have suffered with foot problems or foot pain, or maybe they don't really have foot pain per se, but they have really flat feet. And as a result, their knees bother them and their low back and their hips bother them. So a good majority of people, in fact, who suffer with back pain have problems in their lower extremities or feet, and the arches don't absorb the pressure and shock from each step they take. And as a result, that translates up into the knees, the hips, and the spine. So we're really changing the face of how chiropractors help their patients, both spinally and also from a full body standpoint, from focusing on feet and hands in conjunction with the spine. And it becomes really exciting for patients as yourself, who maybe you've been to a chiropractor, but you've never had your foot or your hand or another extremity joint looked at or treated.
Well, you said something really interesting that I think a lot of people, when you said, when you're exploring and asking questions about arches and those things, the feet, I immediately jumped to podiatrist because, I'll be completely honest. Growing up, I've had problems with, the ingrown toenails, things like that I've had to actually have surgery to get that stuff. And so I see that language, and I would automatically think about podiatrist on that. Now, there's certainly people out there that say, if you have a foot problem, you go to a podiatrist. That's who you go to. And what are some of the things? Because I know that there's options when people go to a podiatrist, depending on what it is that they're working on, that the options are, well, here's some pain that you're going to have to live with, or surgery is an option. So what is it that let's give some examples of some things that you would definitely see a podiatrist for, and that would be the last stop. And what are some things that you may not have to deal with pain or surgery as the final answer, if that's what you've gotten from your podiatrist?
I'm really glad you brought podiatrists to light here, because that really has been the core doctor you would go and visit if you had a foot problem or foot ailment of any kind. And my grandmother went to the podiatrist many times, many podiatrists. And, if she was still here today, I'm sure I could help her with some of the foot dysfunctions that she suffered with. And there's some things that I could not help. And, from a chiropractor standpoint, most chiropractors, I'm not going to say they don't refer to podiatrists, but it's just kind of off their radar. I send a lot of my patients to podiatrists for conditions that I cannot help. And, some of those conditions that I won't treat or cannot treat with the procedures that we offer are things like, common like nail fungus, ingrown toenails, people with chronic diabetic conditions, diabetic ulcerations, or different skin lesions or abrasions on their feet. Those are all things that can be treated very suitably by most podiatrists, but there's other musculoskeletal type conditions, the aches and pains and the burning symptoms from kind of deep inside the foot. A lot of those conditions can be traced to a mechanical dysfunction of the foot. You got to think people have back pain. They think, well, yeah, I bend and lift for a living, but think about your feet. You step out of bed in the morning, and every step your foot's slamming against the ground, and the whole weight of your body is compacting down onto the tiny foot bones and the arches of your feet. And no wonder so many people out there suffer with foot pain, oftentimes disabling. And you're right, they go to their podiatrist. Maybe the podiatrist puts them in some orthotics or that's a fancy word for a shoe insert, or maybe the podiatrist did a cortisone injection or gave them some, anti-inflammatory medication to take. And, there might be some subtle relief the patient experiences, but the foot pain comes back. And eventually, either the option is you have to have surgery, and a lot of people don't want to have surgery. They want to avoid that if at all possible. Or the podiatrist might tell the patient, you just have to live with the pain and just deal with it as best you can. And both of those, are misconceptions. You don't have to just live with the pain, and you don't have to have surgery. That's the beauty behind this. A lot of these deep-seated musculoskeletal conditions can be treated very effectively, non-surgically, with specific chiropractic adjustments or manipulations, gentle adjustments to the foot bones and the joints and bones of the feet. And it helps conditions such as a real common one. If your listeners or any of them are runners, most times runners, they know what plantar fasciitis is. Plantar fasciitis is one of the more common conditions we treat successfully, and that's pain at the bottom of the heel or into the arch of the foot. Heel spurs is another one. If you step out of bed in the morning and, man, it hurts for the first 5 to 10 minutes, you walk and you can hardly put the weight on your foot, then finally that pain starts to dissipate. Or you get up after a seated position out of a chair for a period of time and it hurts the first few steps. A lot of times you have a heel spur, and that's very similar to plantar fasciitis, but a little bit different, and that's another condition that we treat very effectively. So there's a lot of conditions from the hind foot where the heel is through the arch, the whole way up to even the toes, like with bunions and hammer toes, that we can treat very effectively with specific chiropractic manipulations. But it's real important to have it done properly. It's just something, it's an art and a skill that chiropractor must develop in order to really provide that level of care to their patients.
Well, you said a few things there that I want to make sure that, one, I don't miss and others don't miss, that make sure that I understand this. And it seems like you made it kind of clear and easy to think about. External foot conditions, like you talked about, fungus, ingrown toenails, things like that are something that obviously that a podiatrist would be recommended to knock out. It's something that they can knock out. I don't think of those as permanent, although they may come back problems. But right. It sounds like what you can deal with are those internal, where people can't point to it and say, this is where the problem is. Internal pains. And those are some that can be the most disabling and the ones that people, can really affect their lives and their all the way from their mental condition to their physical ability to do things. And I've seen people time and time again just live with that pain because they think that's what it has to be, because it's coming from the inside. You can't take a shot to make that go away. Or they've been told that, like you said, surgery is the option. And that's a big fear. And that's a big decision that people have to make. And obviously there may be times when that is the answer, but to be able to have this alternative, I know there's a lot of people that just listen to what you said that are thinking, now, this is something I've got to look at because I thought I have explored my options, and these are what it is: deal with the pain or have the surgery. What is it that, kind of like with chiropractic care, that I'm used to? I'm not saying I'm knowledgeable from what I understand is, there's parts of the spine that can affect different parts of the body that are indirect. So with the foot, even though people may think of it as not a bone pain or a muscle pain, there's still things that can be manipulated in there that can affect that sensation or that pain or make it go away permanently. Or is it something that they need to do on a regular basis to keep that pain away?
That's a perfect question. That's a good question. It's a common question patients will come in and ask, is this a permanent cure? Well, and I tell patients, there's really no such thing as a permanent cure. In fact, that's against the medical guidelines. We're not allowed to tell somebody there's a permanent fix. There's never been a permanent cure for anything. If that's the case, we'd be permanently cured when we were born, if you know what I mean.
Yeah.
So, but the thing is, there's a long-term solution. So I define it as a long-term solution to a chronic pain condition that they were experiencing, whether it was pain or numbness or burning symptoms into the toes. We help patients find a long-term solution to their problem, not requiring constant dosages of pain medications and cortisone injections. Not that those things are always bad, but they really don't fix anything. So that's the beauty behind what we do. We're actually correcting the structural problem. Some patients, they'll actually get an arch back in their foot without having to have an insert in their shoe. I've had many women who have conceived children due to the increased relaxin hormone in their body and increased weight gain. Their feet got flat, and maybe they went from a size 9 shoe to a 10, because if you have an arch that flattens out, that foot's going to become a little bit longer. So they'll come into my clinic 6 months after they've had their child, and they're having chronic foot pain now for the last few months of their life, and we can put an arch back in their foot many times, and they'll shrink back into a size 9 because now their foot's functioning at a higher level. And of course, their husbands hate us sometimes, get to buy new shoes at that point. the women love it, but we're fixing the structure of patients' feet, and the beauty is we take people that have been walking around with a lot of pain and we make a distinct change to their ability to enjoy life. And that's what it's about, helping people enjoy life with a solution they've never known existed before.
Yeah, I think that's important because people don't realize what a difference the quality of life can be with that pain. I know even from the external stuff like ingrown toenails, there's not a permanent solution to that. It may be fixed. It may come back 2 years down the road. So but that time that you don't think about it, that it is gone, is worth so much as far as quality of life. And I think that is what is really important. And it's also what I think makes you a true influencer, because you're doing things and giving people alternatives that they may not have thought existed, that they thought were perhaps beyond their reach. What are some of the responses, or not just the results in the removal of pain, but what is some of the feedback that you get from patients that you can actually tell that you've changed their lives, so you've changed the quality of their lives by what you've done?
Well, that's the beauty behind it. For example, one patient that came into me, she loved to ballroom dance, and she couldn't dance for years because of disabling foot pain. She had both feet were killing her, the heel spurs and plantar fasciitis. And here's the thing. She was very, very obese. So she weighed about 400 pounds. And I almost didn't want to take her on as a patient because I thought, well, you really have to lose weight. And I told her that. I said, you've got a limited chance of response, but, I'm hopeful we can make some change with you, but I don't want you to get your hopes up. You need to lose weight, so we have to work on this together. And she said, you're my last ditch effort. I've tried everything. I've had surgery already. I've had cortisone. I've taken the medications. I've had 3 or 4 pairs of shoe inserts. Nothing has helped. I was referred to you by somebody else. Let's go through it, and I'm going to give it my all. Well, guess what? She didn't lose 1 pound, and within 2 weeks, she was 100% pain-free, and she got back into ballroom dancing after having not been able to do it for years. So it extraordinarily changed her life. And you know what? I don't know if she lost weight. She might have given up on that. I don't know, but it would definitely help her feet to lose weight. But see, it was the dysfunctional misalignments of her feet that caused her not to be able to enjoy the things in life she once enjoyed so often. Another gentleman, an older gentleman, lived with foot pain for years, and he was a hunter. He liked to go out in the fields and hunt some kind of bird, quails or geese or something like that. I don't know what he hunted, but, he couldn't hunt with his son. And through after a couple of weeks of care, again, his life changed. He can now hunt, and he's pain-free. And a lot of these patients, they'll remain pain-free throughout their lifetime. Some of them, they'll have a little bit of a relapse or return, and they might need to get treated again once or twice to maintain the good, strong, healthy alignment of their foot bones and arches. But the beauty is you don't have to have surgery the majority of times. You don't have to have these continued injections in your feet the majority of cases. So there's a solution that's mechanical, it's gentle, and it makes sense to patients. Patients realize having their feet lined up appropriately after having been misaligned makes sense. They're going to feel better. So by realigning the bones, the feet function and feel better, and people's lives benefit from it. That's all. It changes lives.
Yeah, and I think that really puts a spotlight that we're not just talking about discomfort. We're talking about pain, what we said, disabling pain, life-affecting pain. And I think what I feel makes you an influencer is that people listen to this like, oh my gosh, where I guarantee there's someone listening to this right now, how can I get to, Dr. Fennell? Where do I need to travel to get to Dr. Fennell? And I think what makes you a true influencer is that, you not only develop these specialized chiropractic techniques that you can, that are making this huge effect to, your patients, but that you have also, unfolded these techniques to other chiropractors that take on people to work with these type of foot pains as well. So I want to know is, what influences the influencer? What is it that inspires you, that influences you to do what you do? And not only for your patients, but now to spread this knowledge and share these techniques with other chiropractors that are able to help, an exponential number of more people than you can individually.
That's an extraordinarily good question, Jack. And this is something that motivates me every day I get up out of a bed. And the thing is, I'm sick and tired of seeing so many people suffer needlessly with disabling foot pain when there's a viable option for them. They have no clue. And to match that, I'm sick and tired of seeing so many chiropractors just treat patients' spines and really not even be knowledgeable about this untapped need in the healthcare marketplace. So my goal is to change the face of chiropractic, to get people across America and also globally in different parts of the world to learn about the value and benefits of seeing a hand and foot chiropractor, somebody who's really extraordinarily proficient at treating these many times disabling foot conditions that can be helped so well with gentle chiropractic adjustments.
Yeah, I think that is I can see why that drives you. And because anybody that lives with this pain or even has a family member or a friend that lives with this pain, you can see how much it affects folks, in not just the quality of their life and their family and happiness, but in their work. I've seen people that their businesses have been affected by, not just foot pain, but any type of pain that is, prolonged and I guess disabling is really the only, way to describe it. So, let's say there's folks, and I guarantee there's folks right now, how can they find out more about, Dr. Fennell, what you do, how you do it, and also, find perhaps doctors that are somewhere near them geographically that, have learned these techniques from you?
Well, Jack, and the thing is, patients will oftentimes come in and they'll drive from a distant state or fly in, but my goal is to change that so they no longer have to do that. I've had patients fly from the West Coast and even the East Coast and spend a week or so here to get their feet or their hands taken care of, but you no longer have to do that. See, to find out more about chiropractic hand and foot clinics of America and find a provider near you, or if there's not a provider and you'd like us to work with somebody or find somebody in your area, all you have to do is visit my website, which is handandfootpain.com. That's all spelled out, handandfootpain.com. And on there's a locate a doctor near you link and also a doctor request form where you can request more information about a provider if you don't find somebody in and around your community.
All right. Well, fantastic. Folks, I encourage you to take a look, because there's a high chance that if you're listening to this right now, this is affecting you either because you're suffering from it or someone love, or depend on is suffering from it. And I think you're going to find some really good information and see that there really is an alternative to just dealing with the pain or surgery if those are the options that you've been given. So, Dr. Robert Fennell, I want to thank you for being on Influencers Radio. You truly are an influencer, like I said, beyond just your patients, but to unfolding this opportunity for others, nationwide through the doctors that you have taught these techniques. So thank you very much for being on here and sharing this with us.
Thank you, Jack, for having me today, too.
All right, folks. Visit Dr. Fennell's site, handandfootpain.com. And until next time, remember, you are the only real game changer.
You've been listening to Influencers Radio. To get all past shows and updates on future shows, visit influencersradio.com today or follow us on Facebook at facebook.com/influencersradio.